patient safety indicator and hospital acute conditions. Okay, so when it comes for the patient safety indicator, so it is a standardized quality measure developed by AHR or sorry AHRQ to identify the potential, okay, to identify the potential preventable complication and adverse event that occurs during the hospitalizations. Okay, this is something like we call it as AHRQ, Agency for Healthcare Research Quality. Okay, so this is an organization which is developed by HHS, or if you see like this HIMA and this CDA, this all comes under one of the biggest entity. When we are discussing on UDHHS, I will tell you, okay, those are called Department of Health and Human Services. Under that only, under federal law, under the federal law, we have the HHS. Under the HSS only, we have UDHHS, and based on that only, all these are assigned. This AHRQ and other, what is that? Previous also we have seen one entity, right? What is that? The entity name like FCA, then CDA. These are all entities, these are all organizations and groups. They all, even this False Act, okay, OGI, all these are coming under this HHS only. Okay, that is health department, one of the biggest health department which is maintained by the federal government. Okay, so what they basically done, they have standardized the measure. Okay, so during the hospitalization or during the patient hospitalization, so they are indicating with the indicators. Okay, so the indicators, mostly if you see this indicator, that will give you what is the complication, so how that complication can be prevented. Okay, they have some numbers. Okay, it will categorize under that. Based on that, we'll be able to come to the conclusion in what category it is. Hello, Guna.
Sir, mistakenly that was
Okay, okay, okay. I was keep on explaining. Fine, fine. No issues. Okay, okay, fine. So again, this patient safety indicator. So they're going to provide you like it is in a kind of a standardized what is it, a standardized indicator. So they have given some of numbers. Okay, so what it will do, it will provide you the whether the patient is having the complication, if he is going to have the complication, whether that need to be prevented or not prevented. Okay, so what is the adverse event is possible, okay, or what is the possibility of the or a complication may happen, that will be indicated with then certain numbers. Those are standardized and provided by the CMS. Okay, this is completely, these are standardized and given by the Center for Medicare and Medicaid Services. And when it comes for the hospital acute conditions, during the admission, you have some problem. After admitting in the hospital, you are going to have other conditions. Okay, those conditions in the stay, in the during the stay of hospital, you've been identified or you've been diagnosed with the new condition. Those kind of conditions are called hospital acute conditions. So these are interrelated, where the indicators will be used near almost the PSA indicator. Most of the PSA indicators will be used along with the POA. Okay, in certain situation where that will be used along with the hospital acute conditions also. Okay, and one more important thing, always the POA for the hospital acute conditions are going to be N. Okay, so if the condition which is say for example, a patient is admitted in the hospital for a long time, he may end up with the pressure ulcer or pressure ulcer soreness, so which will be indicated with the present on admission, means no, it is not during the present on admission, it is occurred during the hospital condition, that will be indicated with the N. Okay, so this HAC, what is the purpose of this HAC means, again, it is going to be an additional payment for the hospital through the patient. That is the main reason where we are addressing the hospital acute conditions as well. Okay, and this patient safety indicator, so this will keep the patient in control. Okay, which will not make the patient to fall under the complication or adverse effect category. Mostly this happens after the surgeries or procedures or the hospital stays. During the hospital stays, this hospital stays, you may end up with the using the patient safety indicator. So we'll see some of the examples, we see some additional inputs on this both. Okay, so first we discuss on patient safety indicator. So understanding AHR framework for identifying the potentially preventable adverse event using the administrative data. So by keeping the hospital data, I can keep the patient in control so that I will not end up with some kind of problem. So it is developed by the AHRQ. Yes, it is developed by AHRQ also. It is maintained by the Center for Medicare and Medicare Services. Okay. Then use administrative like ICD-10 and PCS data to identify the event. Then primary purpose is to measure the quality of the care and identify the patient event. Then support quality improvement and not direct payment denial. Risk adjustment metrics focus in the inpatient care. Okay, so we maintain the risk matrix, especially in the inpatient care. Then not all PCS are considered technical error. Not all PCS are considered technical. Yes, this is sometimes happens because like PCS indicator will be default provided. So what happens without fail, the PSI indicator, okay, PSI indicator will be provided with the documentation where it will end up with where there is not required for the PSI, we will be ending up with the PSI. So that is what happens with this artificial intelligence sometime when you're doing the automated coding. So that is what I added that point also. So these are the some of the points which will be coming for the patient safety indicator. So on the exam point of view, we are not going to use anything, only just a definition and description on the PSI. So we have some of the indicators. So these are the some of the indicators we are using for the PSA. So PSA 03, PSA 06, PSA 07. Okay, they may ask you the questions. Okay, mostly if you see when it comes for the domain 4, that is going to be a little difficult for us because we will not have any supporting documentation. Okay, we will not have any supporting documentation to answer what are the questions they're asking, especially when it comes for AHC and PSA. And we have for place of service also. So these three areas, it is going to be little challenging for us. But still, how I can bring it to the conclusion means, yes, when you go back and check in the ICD book, in the end of the ICD book, you may have the indicators, PSA indicators, and you may have the hospital acute indicators, which means symbols are provided beside prefix to the or suffix to the ICDs. Okay, in the tabular list they will provide. Okay, when they're given some indication or when they're given some disease condition, when they're given some scenarios, come to the conclusion what is this condition for, and search that condition in the index page. Through the index page, go to the tabular column. Check in the tabular column whether, say, for example, pneumothorax. For the pneumothorax, is there any PSA indicator? Symbol is provided or not? If it is not provided, it is very clearly explaining this condition is not going to come under the patient safety indicator because this condition is not going to do anything for the patient. That is the reason it is not indicated with the PSI. You will be able to see in the back side, okay, in the table is same way HAC also, okay. In the HAC, any conditions. So it is not like all the conditions can occur happen in the hospital. Say, for example, head injury. Head injury is not possible in the hospital, right? Somewhere he has to meet an accident, then only he can get a head injury. But when he is hospitalized in the bed for a long time, I cannot give any head injury as a HAC. Okay, so here what it tells you, it gives you which are the certain condition can be occurred through the hospital, which are the certain condition which may become hospital acute condition or present on admission condition, which may become the complicated condition. Especially, say for example, if I'm coming for a knee orthoplasty, when coming for knee orthoplasty, I will be doing the orthoplasty. The orthoplasty will be fixed. Now I need to do an indicator. I need to provide an indicator. Okay, so say for example here, what indicator I can use is like hip fracture is given. Okay, knee is not given. So we'll take example for hip fracture only. Okay, so post-operative if hip fracture. So patient is coming with the hip fracture. They are treated with for the hip fracture. They fix the fracture. Now that procedure will be indicated with the PSA 08. Why? Because there is a complication. There is a complication may happen. Like what type of complication happen? It can be become an infection, or it can become a failure, or it can become a broken. Anything may happen. It may become the misposition or malposition. Any one of the complication will end up with. Okay, that procedure will end up with any one of the complication unless it is getting healed. So along with that procedure, I'm going to use the PSI modifier, where PSI modifier will be used based on the ICD, but I will be indicating with the procedure. So that is what very important. So for hip fracture, post-operative hip fracture, like hip fracture code, I'll be using the PSI modifier, where you can see that indicator in the table list also. Okay. So same way, when you are encountering the questions, especially in the CCS exam, when you don't understand, use the book appropriately. Use the book very clearly. Book will help you out. Either in the PCS book or it is in the ICD book, you will be able to get an additional information related to the PCS or HAC. So these are the some of the example commonly used. There are so many indicators are there. These are some of the indicators. So only place where I cannot end up means I will provide you the PDF for this also. For indicator PDF, I will provide you. You need to a little memorize these things. Okay, at least some 10 to 15 PSA you need to memorize. Why? Because they may ask you, say for example, if they're giving you post-op, say perioperative hemorrhagic or hematoma, what is the PSA indicator for this patient? We cannot know, we cannot identify that. I know PSA indicator will come, but whether the indicator, what indicator I should be used, I will not be aware. So in that scenario, I need to memorize whatever I memorize, I need to use that. Okay, so mostly it won't be very complicated, and most of the time, if you see out of 10 exams, they are asking 1 or 2 exams only, they are asking directly to the indicators. In that scenario, yes, see 95% you can end up with the book. Okay, in 5% of scenario, I will provide you the PDF. Just go through that PDF so that you can remember this PSA indicators. Okay.
Okay, sir.
These are the some of the PSA indicators for pressure ulcer, pneumothorax, and central and associated bed stem infection, hip fracture, hemorrhage and hematoma, then pulmonary embolism, then a post-operative sepsis, then accidental puncture or laceration. So PSA 15, 13, 12. If you ask me, it is a little difficult to remember also. So usually how I used to think is um, I can tell you it's better to correlate with something, associate and study with something. Then only you can be able to memorize this, because we do not have any sequencing involved for this. So directly they are, by the CMS or by the AHRQ, they are provided directly. Okay, these are the indicator for this scenario. These are the indicator for this scenario. So it is always correlate with something and try to remember them. Okay, that is how the safety indicator works. But no need to do it. I will help you out in that. Then CMS hack categories. So in hospital acute categories, okay, the structural breakdown of the diverse clinical condition classified as the hack, which means hospital acute conditions. Here, infections, they are coming under one category. Serious adverse event, they are coming in one category. Then trauma and injury, they are coming in one category. Then other conditions are coming under one category. So they are categorized. Okay, this HAC hack has been categorized in 4 different categories. There is infection, serious adverse event, trauma, and other conditions. So how it is going to be useful for practical purpose, how it is going to be useful for the exam purpose, means an exam point of view, they may ask up with some condition, and they may ask so they may come up with some hospital acute condition, and they may ask you which category it belong to, where it is belong to first category, a second category, a third category, a fourth category. So very simple. 4 only is that: infection, serious adverse event, then trauma or injury. Trauma or injury will be third, and other conditions are 4. So try to remember this. Okay, so they may ask you, they may give you some condition, they may ask you what category it is coming from in the exam point of view. In the procedure point of view, we are not going to use anything. Okay, we are not going to categorize anything. Only I need to just indicate the modifier. So I need to indicate I need to use an indicator, POA indicator, saying that POA N. If I use POA N, means I can directly relate that to hospital acute condition. Okay, that is how these 4 categories are given for the hospital acute conditions. So if you see CMS hospital acute conditions, so infection and other condition. If you see in the infection, the first category, that is like a catheter associated urinary tract infections and infection, surgery site infection. This all, if you see, that is what clotty and clubs. See, I means infection, ending with the infection. So those are coming into the category 1. Try to remember that I, ending up with the I, infections. Then other conditions, stage 3 pressure ulcer, falls, injury, air embolism, and blood incompatibility, retain surgical items. If you see these all are going to be indicated with POAN and to affect the payment. So it must be POA is equal to N to affect the payment. So that it will indicate directly those are hospital acute condition. Here, if you see stage 3 and stage 4, it is coming under trauma and injury, third category. Then fall and injury, trauma and injury category. Air embolism, that comes under the serious adverse event. Then blood incompatibility, that is also comes under serious adverse effect. Then retained surgical items, those will come under following the certain surgery. Retained, that is also coming under the serious adverse event. Okay, so try to categorize in that way. Trauma is easy for us, infection is very easy. Apart from that, these 2 are going to be little critical. But if you see for other condition, means usually that other condition will be mostly this chronic condition or very long term existing condition like diabetes, hypertension. Those are the conditions it will be. So you can think like this. This condition may occurs because of some other condition. You remember etiology and manifestation. So if you're going to put under the category 4, those conditions are going to be the manifestation condition, which means it will be induced by some other conditions. You can remember like that. Okay, that is what the other condition which are categorized under the 4 for the HAC, which means hospital acquired conditions. Then condition impacting the PSI and HAC. So yes, certain conditions, okay, that secondary diagnosis which may trigger both the PSI and HAC here. So if you see here, timing of the condition, clinical indicator, query required if unclear. Okay, so these are the documentation support. Okay, so where the secondary diagnosis, especially the secondary diagnosis, they may trigger for using the PSI. So I was telling you previously about one example related to the PSI indicator, which I was telling you for the hip fracture, right? In the hip fracture, we are going to use the PSI. There is a chances where you may get with the secondary diagnosis also where you should be using the PSI indicator, not only for the principal diagnosis, also for the secondary diagnosis also you may use the PSI. So in what situation I'm going to use? So there it may be like a time of the condition, clinical indicators based on the clinical indicators are what time the condition is acquired. Based on that, we may end up with the secondary diagnosis. For that secondary diagnosis, we may use the PSI indicator, or we may use by indicating the hospital acquired conditions. Okay, then critical coding of POA status. Okay, so present on admission documentation and accurate medical coding and reporting. So how this POA used? Okay, especially when it is combining with the PSA indicator and hack. See, this is a little interesting. So must verify first. What I have to do, must verify the present on admission status for all the report codes. Okay, now whatever the codes, so prior principal diagnosis, secondary diagnosis, hospital acquired diagnosis. Sometimes this hospital acquired diagnosis may be the secondary diagnosis also. Okay, these all things I need to verify first. So I need to indicate what are the indicators, whether it is a N, S or N or W, whichever indicator I need to use. Many PSI, remember, many PSI exclude the condition that were already POA. So which means condition which were already POA means which is the indicator yes, Y is telling, PSI indicator will be excluded. So what I'm trying to tell is like all the PO indicated with yes cannot be indicated with the PSI. So which means like 90% of the PSI are getting indicated for the used as an indicator for the secondary diagnosis more than the principal diagnosis. That is what they're trying to tell. That is the interesting part. Then direct financial penalty if the condition is reported as a hospital acquired. So this is something additional point. Like there will be a penalty if you're going to report directly as a hospital acquired condition. Then accuracy is very high priority for the hack payment determination. So that is very, very important. So hospital acquired conditions should be very properly indicated with the POA indicators, then with the PSA indicators, because it has a high priority of the payment. We need to be very careful. Distinguish between POA condition and adverse event is vital. Yes. Okay. So I'm coming for treating one thing, but I'm ending up with some other problem and complication, okay, which I will be indicating with the PSA indicator. So I need to be very careful using these both indicators to make sure the quality treatment is provided, and at the same time we're keeping the patient condition in the control without any complication or ending up with the life-threatening conditions. Okay, so this all together they forms the PSA indicator and hack indicators. Then major difference. So if you see PSA, it is by the EHREQ and hacked by the CMS. It is a quality pay measurement. That is a payment reduction. Okay. And it is like a POA relevance. Yes, it is mandatory. Okay. When it comes for the POA, definitely you have to use. When it comes for the POA relevance on PSA, yes, they're telling yes, it can be excluded most of the time as we see in the previous point. Then payment impact indirect. So PSA indicator is not going to impact the payment. Why? Because it is giving the quality care for the patient. Based on the PSA, I'm not going to do any payments. Okay, but hack directly it will impact. If I don't give the secondary DX as a hack, if I am not telling a hospital acquired condition means the payment will be more, because we may think like during the hospitalization there are so many conditions being due to the so many conditions the patient has been hospitalized. So all the conditions will become the principal diagnosis. No, principal diagnosis means maximum one or two will be there. Other conditions, acquired conditions, secondary diagnosis and all, we need to indicate with the modifier, which is like payment impact will be direct. Then used in quality reporting, used in ACK reduction program, which means like payment reduction program. This will be used. These are the key difference for the what is it PSA and hack. Then coming for the next one, this is on the some example I provided, just a general exam I provided. So as I told, ensure accurate PA assignment. That is very, very important. review the secondary diagnosis carefully, identify the condition that may trigger PSI and hospital acute conditions, then support CDI, which means clinical documentation integrity and quality terms, then prevent inaccurate DRG grouping. Okay, that is also very important. DRG grouping means that is coming under the CC or MCC that we'll be discussing in further, that we need to be very clear. See the example with the infection. Yes, come with infection developed after the 4 days. Hack. This is an hack. Okay, if POA is equal to N. So the patient has come with some infection. I'm not abbreviating that. Patient is coming with some infection. Okay, now the infection is developed on the 4th day. Definitely, I'm not going to indicate with the POA. Why? Because it is hospital acute condition. Then next example, if you see pressure ulcer on the admission. Pressure ulcer on the admission, the POA is going to be Y. Why? Because during the admission, present on admission, he is having the pressure ulcer. I'm indicating it Y, and it is not a hack. Then it is not a hospital acute condition. Then post-operative sepsis is unclear onset. I need to query back the physician. Then fall with the fracture in patient. Hack if not POA. Fall with the fracture in inpatient. So during the inpatient, he has got the fracture. That is what they're telling. Hack, if I'm telling a hospital acute conditions, means I cannot go with the POA indicator. So that is what some of the examples just I provided for the exam, like CCS exam related scenarios. Okay, so this is on the PSI as well as hack. Okay, again, as I told, for the hack, based on the secondary diagnosis, you will be able to understand what type of condition, whether it is a POA is Y or N. When it comes for PSI,